Very much. Thank you very much, Tawapa, for the opportunity to present to you all today. My name is Michelle Cusack, and I work in the Australian Immunisation Register as a Business Development Officer. So today's presentation will be covering the following topics. So we'll do another recap on the recording of encounters on the air. For those of you that were with us in July, we obviously did this as well. So I would be just being a few variations tonight. And then we'll do the deep dive into our 10A and our 42A report with a live demonstration for you on actually how to request that report and what the data will look like once you receive it. So before we go to the AIR website to record some encounters, just quickly, why would you? Why would you go to the AIR website if you've got software? Now, it could be that your software won't allow you to actually transmit any vaccines for someone that perhaps doesn't have a Medicare card number. So you might use the AIR site for that. Or perhaps there's been a new vaccine added recently to the AIR. Could be the software vendor has yet to roll that out to their sites, or perhaps your practice has yet had a chance to upload the patch or whatever it is. So you will, if you've started administering that vaccine, you will find it on the AIR site. And then lastly, and a very important one, is if you have uploaded some information to the AIR that you realize is incorrect, you need to update it. The means to do that may not be available to you in your software, but it is available perhaps on our website. So just another reason why having access to the AIR website is a great backup tool to your software. So I will now log in to our AIR website. So again, for those of you that were with us in July, we actually registered for a Proda account, and so I'm not going to go back through that. You can, of course, revisit the July webinar. It's on the Practice Assist website. So I've just put in my username that I've created and my password, and I'm going to log in. And of course, we've got the two-step verification for security purposes. And you might have just heard that. I just received my code. Okay, right. So I've logged on to Proda and I need to go to my linked services. And we find the AIR website, of course, on the Health Professional Online Services. So I click in this option, go to Service. Now, some of you may well be like myself. I have got here no organisation, proceed as an individual is one option to get to HBOS, but I also am a member of organisations. So perhaps your practice is registered as an organisation for AIR and you can proceed to the AIR website that way. Or if you are a delegate for a doctor, in that case, you would always choose no organisation, proceed as an individual only. Okay, so now it's saying hello, and this is the entry page. Just this banner information's here. They do change. They don't stay the same message all the time. Just give it a quick look if you haven't logged on this week, perhaps, just to see if any of it relates to you. If it doesn't, just disregard. So we need to go to My Programs and to the AIR site. But if I was to go there right now, I'm not going to have any access. Actually, I do apologize because I was just in here getting ready for our webinar. It's already showing me as acting on behalf of the doctor. So as you can see up here, I'm already acting. So I will go straight to my programs. All right. And that's why I can now see the AIR tile. Okay. So the first questions that we've got here is if I wish to record the healthcare provider identifier field and the healthcare provider identifier for the organisation. I don't actually have to, and therefore I'm going to go next. All right, so that's the welcome page to the AIR website. And I hope it's not brand new to everybody, but in case it is, that's okay. As I say, we have got the other webinar, which we will go through more information. So tonight, I'm just going to do a few variables. So what you would normally do when you go into our AIR website is you would go to identify an individual, because that's why you would be coming here. So what you can do is you can use a Medicare number and the patient's individual reference number, or if they don't have Medicare but they have an individual healthcare number, healthcare identifier, you pop it in there instead. All these little informations will give you information if you click on them there. But what I'm going to do here is I'm going to actually use a child, or make up a child, I should say, that is new to Australia and has not got Medicare entitlement. So just to show you again, you can click on the year and then you can go back to the year you want and choose a date. There you go. In gender, we've got male, and I'm going to do a search, even though I'm pretty sure the child is not registered. It's always good. You need to do your search first of all, and I'll click there. Now, up the top here, it's telling me the individual has not been found, which I fully expected, but the only time that you probably really need to be doubly checking is if you haven't got a Medicare number. If you've got a Medicare number, you're going to get the details presented straight away. If you've got an IHI, you're going to get the details. But when you input a person's details that you don't have any identifying numbers there for, please just do a double check. They may be known as John, but perhaps their official name is Jonathan, so you're not going to get a match. So just always be doubly sure when you are entering anyone that doesn't actually have a number to refer to. So now we're going to create this individual. So is John Indigenous? No, he's just come to Australia from overseas. We ask you to put in the address as well, because our air team will endeavour to see and check if there is a record for the person or any existence, be that one where it's a Medicare number, or if they've already got a record that we created in our system, to just record all of their immunisations together. So I'm going to pop in the address, and now it's created some details up here for John. So first question, who performed this immunisation encounter? So this one is actually the third option down the bottom there. This encounter was performed overseas. So I'm going to choose that option. And therefore, it's going to ask me for the country of immunisation. And I do have a drop-down list there, so I can just choose wherever. We'll say Denmark, for example. Now, because this child's come from overseas, they're not going to match in with our Australian schedule. So we want to choose other. If we were to choose like this 12 months old schedule, we're only going to get the vaccines that are here done in Australia. So always default that to other, and then our data service. So we just go back a little bit perhaps and choose the date, and we can start to put in the details. Now, because it's from overseas, it may not have the actual brand details. So we will just choose, for example, a generic hepatitis B. Now, also the batch number. Because it was done overseas, we may not have the batch number. So what we ask you to do in that case is key in not recorded or one word, okay? And then you can just put in the dose, whatever it was, and we're going to add. All right, so we can see there, we've got the generic hepatitis B, done overseas, done in Denmark. Now, because we've got the child in the practice today and I've popped that through, I'm actually going to add another one because we've actually given them a flu shot today. So this is where I'm going to choose, I performed this encounter, meaning the doctor that I'm acting on behalf of, not my actual necessarily myself, just in case you might have admin staff that use the AIR website. All right, so the schedule, again, I can ignore that if I wish to, and just that makes it easier. I'm going to choose today's date, perhaps. I'll go back here, get back to 2023, August 31st, and given the child a VaxiGrip tetra. Okay. Batch number, compulsory, mandatory for all NIP, flu, and COVID-19 vaccinations that are recorded. So we need to pop that in there. And the dose number, which will make 3, and add. So what you can see here now is we're not only adding an overseas information vaccination, but we're also adding the flu shot that we've done today, and we submit. Okay, that's what we always want to see at the end, is the success that we've now recorded that for John. So what I'm going to just do now for you is show you how you can use our website as well for doing a catch up. So I've got a Medicare number for this patient. Okay, so this is the one patient here, Butterball Brown, and the Medicare number. Have a look at the details. Now, we obviously don't have a catch up in place because, of course, you can only ever have the one. Just come on down here to the due details, and you can see we are we are overdue for quite a lot. Now, before, of course, we put a catch up in place, we will try and administer as many as we can today, and have an understanding with the parent or guardian that they will be returning to actually ensure the child does get caught up, because you can only ever have the one catch up. So what I want to do is I do want to click there that I am putting the child on the catch up, and I'm going to save it. Okay, so what you see now when you go into this child's record is they're on a planned catch up, and the catch up schedule exists until February 29th next year. And that gives us that time, obviously, to bring the child up to date. So it's as simple as doing that. Now, I mentioned earlier about you can use the website in case you realize that an error has been made in the upload of information to the air. So again, I've got a Medicare number here. This is an older patient, as you can see, 1935. And I'm just going to scroll down and have a look at the immunisation history. And always I click in the date given because that will actually populate the vaccinations in the most recent date first. And I can see that even though the gentleman was born in 1935, we've inadvertently recorded that we've given him flu quadri when of course we would have given him fluid quad. So I want to update that. So I go over here to the menu to update encounter, and you'll notice the flu quadri has this pencil, which is an edit function. I can't change these three. It could be they're too old, a payment might have been made, or simply record it under a different provider to the provider that I'm logged on for. But I'm happy. This is the one I need to change. I'm going to click on the edit. It brings up the details. So in actual fact, I could change data service if I'd gotten that wrong. I haven't got that wrong. What I have got wrong, as I said, is I want fluid quad, right? Which will obviously mean the batch number is also wrong. So I'll just update that as well and update. Okay, and you can see it's that quick. Down here, it's now showing fluid quad with the right batch number. Obviously, that's what we want. Okay, and the last one I'm just going to show is a medical contraindication. Now, I've still just got poor John here, but that's okay. It probably won't be relevant to John, but just to show you how you would actually do that, you would still obviously start with your identify your individual. So I actually going to bring up a child's record instead. Search. Okay, so we've now got a child's record here. So scrolling down, there are various vaccines down there that you can see a child is overdue for, but I do wish to record a medical contraindication. Now, in the general world, of course, you would have providers that probably are across different practices, work at different locations. Because this is our test site, I only need to worry about selecting there, but it is important, obviously, if you've got a provider that's got perhaps 3 or 4 practice locations or perhaps even more, just make sure you do select the one that relates to the practice that you actually are recording the medical contraindication for. And then your vaccine brand, so I'm just going to make that MMR. And I have the option, is it permanent or is it temporary? I'm going to make it permanent. And then the reason is previous anaphylaxis. And it also just asks for the date of that. So again, you can click on this, go wherever you need to go and pop it in and then add it. Okay. And what it's asking is did you want to add any more? No, I don't. And I submit. Okay. And now this child has those details recorded. So I'm going to leave our website there and just go back to our PowerPoint presentation, and we're just now going to move on and talk about the reports. So I obviously want to cover those off for you. So what we're talking about tonight is the 10A report and the 42A report. So the 10A being the due and overdue practice report, and the 42A, which is the COVID-19 vaccination report. For general practice providers, the great thing about these reports is that individuals are linked to the practice through the Practice Incentive Program ID, we call it PIP, or the Medicare Benefit Schedule Service History. So you can extract the information for all the providers at the practice location for current and active patients. So there are options. When you request an AIR report, you customize it to what it is that actually suits your needs. So you can use a report and you can actually get a multitude of customized results. For this reason, when you do request a report, you should label each report with a meaningful description. You won't need to worry about calling it the AIR 10A because that's going to come back in the title anyway. So that's why you can add whatever it is that you might actually be looking for in your database or in the AIR database. So once a report is requested, you can modify it as well. I will show you that shortly. So with regards to the AIR reports, what you can do is you can request them on a weekly basis. You can put that in your AIR website, request it to be run weekly, and that'll run for 12 months. You won't need to re-request it. It'll actually just be there every week waiting for you. So what we're saying here is if you don't get to the AIR report 1 week or even, for 2 weeks, don't go back to those earlier reports. Always use the latest version because the data obviously does change. You saw as quickly as I changed that flu quadri to fluid quad, how quickly that the data can change. So you always want to make sure you're working with the latest version of the reports. So when you do request your reports, you can request them in two options. You've got your single file format where all the personal and vaccination details are presented in the one spreadsheet, or you can do it in a comma separated multiple file format. And that's where you'll get these different files here where you can go to get the personal details, the vaccine details, and provider details. We find the single file format is the easiest to use. And that's why this evening I'm going to just show you some samples of single file reports. Once you do download the file, it is in a zipped format. The file have different names, components there. This one here, the BP, is your banner page. And then the single file report will have all the data in this single file report in that date format there. The multiple file, of course, does have all those individual ones. Once you've got your report, what you can do is you can use the Excel tools to actually help you identify what it is perhaps you're looking for today. You might be looking for under 5-year-olds. You might be looking perhaps for perhaps people in your area. There might be a measles outbreak. You might be looking for people that are not up to date with their measles. So you can customize the data once you've got your report. So when you get it, you get your overdue and due. You can see here on this example, we're overdue for this range, and then we have due dates in the future for the human papilloma, the meningococcal, and the pneumococcal one there. So that gives you a chance to actually obviously work out your recalls and monitor your patients. It will display COVID-19 doses if it's been recorded in vaccine history, but there is no status with the vaccines for COVID. All right, now the 42A only, obviously, which is the COVID-19 vaccination report, will only give you the COVID vaccines. So it'll give you the COVID vaccine last date and the number of doses that a person has had. And it is linked to the GP clinic, again, by the PIP ID and the MBS. So you can assess the patients based on their age, last vaccination date, total doses, no doses. So we will get down to that shortly. So let us go now back to our website and go to the reports menu. Now, the reports are specific to provider type. So obviously tonight we're focusing on general practitioners, and we'll start here, the 10A report. So we're on request and we click in here to the 10A report. You see here there's a little bit of extra information that you can see there. It talks about that it will be the Medicare GPs with data linked to their practice incentive program, due and overdue, etc. So that's what we're going to request, the 10A. All right. Now I'm just going to bypass the name of the report for the moment because it all does depend on what we're going to actually select for our variables here. So what we would suggest, of course, is let's get this report weekly. And we'll have that for 12 months. There we go. Again, we do suggest a single file, but it's perfectly up to you. If you want to record a request of multiple file because you'd prefer to work that way, these are going to be your reports. So you order exactly what you would like. This is where you would pop in the Practice Incentive Program Practice ID. If you're a nurse in the practice and you might not be aware of that, your practice manager will be able to tell you that one. And then we look at the Medicare benefit schedule service period. So how far back do you wish to go? You might want to go 12 months. You might want to go 24 months. Again, that is perfectly up to you. So we'll just choose 12. And then your immunization status is the next question. Do we want all individuals or do we just want those that are not fully immunized? Choose there. And here we've got due and overdue by disease. So you can do all diseases. Makes sense to do all diseases because I'll show you in a moment when we get the sample data, we can manipulate that, as I mentioned earlier, to, for example, a measles outbreak. And this is where we need to choose birth dates or ages. So obviously ages is probably the best way to go. Now, because of the amount of data that is in a report, we do have to limit the age range that you can get in that one single report, because otherwise it's just going to be too big. So the initial one, of course, is you can get all of the children from birth to 5 years. You can or don't have to include individuals that have a natural immunity or a medical contraindication or a catch-up schedule, or you can. That is purely up to yourselves, or perhaps someone that's got a return mail flag. You may not want that, or you can select all. Again, your report, whatever you think is going to give you the best information for you. Now, down here, this is the output settings. So what do we want in our report? We'll obviously want Medicare number for the individual. We'll want the address, the addressee name. We may not want or need country of birth, contact number, email address, because these are going to be your patients and you will have that information. But by all means, select whatever you wish. Due and overdue. We want vaccine details. We want the information provider. And we may also want to have those information there. So this is where we would request a report. I'm just going to click it. It's going to tell me that I haven't put a name in, which I deliberately left. It's also going to say I haven't got a PIP practice ID. Unfortunately, in our test site, we don't have a PIP practice ID to use, but that's okay. So what I was saying before about using a name that's going to let you know which report it is you've got. Remember, we went back here and we had birth to 5 years. So we might put in there under 5 years, expires 08/2024. And then we're going to re-request it. Now, as I said, I can't unfortunately get that to work in our test site, but that is what you would input into requesting your 10A report. So now I will just go back to reports because I can actually request a 42A to show you. So let me just do that one for you as well. So this one, of course, is our COVID-19 vaccination report. Again, I'm going to disregard the name for a moment and just come on down to frequency of report. Again, I'm going to have this weekly and I'm going to get it for the next 12 months and it'll expire then. I'm sticking with my single file. Now, in your practice, you would obviously be putting the PIP ID because it's going to capture all the doctors at the practice, even the locums, long as they've been added to the PIP registration, which I'm sure the practice manager would be on top of, they will appear in your report. Okay, so we only ever need to order this once, and it's the same with the 10A. So I am going to get past that because I am going to let it default to my provider number there, which is of course the test site. The service period that I want, again, 12, 24, whichever period you would like. Always, if you need extra help or just to try and clarify, click on the help buttons. Anything with the help is going to have a little bit more information for you. So obviously this is COVID-19, so that's the vaccination type. Now, you can specify if you like. You can specify people that have received Pfizer, people that have received Moderna, but again, we're going to manipulate the report, so we're not going to specify. We just want all COVID vaccinations. We also don't need to specify how many because we want all. We can leave all of those. And then if we click age, we're actually going to get in the one report, because it is only COVID-19 vaccinations, we're going to get from 5 years to 80 plus, and that's what we would want. So, and again, down here, do we want return mail? The individual's details, obviously Medicare number, address, addressee name, anything else you might want to know, Indigenous indicator, and then the vaccine details, provider information, and whether they've got exemptions. Okay, and we're going to request a report. Now, again, I didn't pop this in. So this is over 5 years plus. And I can put in, if I want, expires 08/2024 and request a report. Okay, so success. Now, if I now want to request under fives, I can go to modify and I can change it. So this is what these tabs are about. Request, obviously where I go in and request. Modify is where I've got a report. Here's one here I've already requested. So I've got 2 of them. I don't want those now. Well, I don't need 2 of them, obviously. So I'm going to go into this and modify it. And you can see I don't need to change everything. I'm just going to change by age and go from birth. Whoops. Oh, if I could click it. Birth to 5 years, just so that I can get, and I'll, of course, should have changed the title, but anyway, I can do that now, and modify and change the title to under 5 years. So, under 5 years, and request report. Okay. When the reports are ready, we simply go to view, and we will find our reports here, and the options are to download or remove. Now, this is where if you've got your 10As, obviously getting those weekly, you can obviously go back in and remove the old ones if you've got the new one and just clean this up so it's not so messy looking, purely up to yourselves. Now, when you request our report, generally you will receive it on the same day, but not always. So you don't necessarily want to be going and logging back into our air site to find out if your report's ready, and you don't have to. If you go down here to the provider menu, this is where we can actually send you an email to let you know the report is ready. Okay, so if you have the email notification set to no, or if perhaps the email address is wrong, just click in here and update it and put in your new email address and change your notification. Obviously, this one's set correctly to yes, but if it was set to no, we would just click that and we would update. Okay, that way you've requested your reports, but you don't need to be coming in and checking the view to see if it suddenly appeared. So that's what we would suggest you do. Provide a menu and get your email notification to let you know the report is ready. Okay, so that's how you can you can request your reports. What I want to show you now is what those reports actually look like. Okay, so this is the 10A report. Okay, so this is how the data appears all across the screen there. But what you can do is you, of course, you can change it and manipulate it. So just to show you, there's the individual, that's the first person on the report, the second person, the third person. Just highlighting here for you, this is what you'll get back, the Medicare number, the child's details, date of birth, gender, etc., whether or not they're overdue. In this field here, or I should say in these fields here, you've got all your vaccine details. So that's the vaccination immunization, or the immunization history that we have on the AIR site. If your clinical records show additional vaccines that are not showing, we would ask you obviously to please update the AIR so we can complete this child's record. So then over here, are we overdue? Yes, we are. This is highlighted here. We've got these 4 vaccines that we're overdue for, and it also shows you in the future what young Chloe, when she would be due for these additional vaccines. And then over here, we have exception, the medical contraindication vaccine. Oh my goodness, the medical contraindication, if there is one in place. And we don't actually have one in place for Chloe, but for young Nulla here, we do. So you can see that easily as well. So what you would do if you were looking at this, Chloe is the first one, there's the history, and we're overdue. Easy, there's a recall. Now, this is what I was talking about before about changing the result of your request for the report to whatever it is that you need to look at. So this is the most recent one. I'm going to add in the filters here because, as I mentioned, I need to see if anyone in our practice is overdue for the measles because suddenly there's an outbreak. So I've got here 4 records, but that child there is obviously, I hope you can see that, not due until February 2024, but I do have 3 children here that are overdue. So that would be my starting point, obviously, if there was, as I say, the measles outbreak. But you can obviously look at this and reduce it down to whatever it is you need to do. Obviously, looking at simply all your overdues is great. If you don't get to the bottom of the report in that 1 week, then disregard it and then move on to next week's report. Okay. Now, this is the 42A report, and it's obviously very similar. So we've got the data as it appears when you've requested it in that single file format. And we can here just show you that we're going to, obviously, because it's the COVID and nothing else, we've actually got 17 patients' details there on that one screen because we're only getting the COVID vaccinations. Again, all the individual details are here. So patient's surname, Medicare number, etc., gender, and you can see I'm just going to go to the next slide just to show you. I've highlighted here the last COVID-19 vaccination date and the total number of COVID-19 doses, all shown there. Again, the vaccine details here for Andy. We've got 3 COVID vaccines shown. Again, if your clinic has got a 4th, obviously please update that so that we can correct Andy's record. And then if there was, obviously, if you wanted to, again, look, Pfizer, I'm not going to say it, Pfizer, you can, because this is all possible for you to make the changes to the data from what you've actually downloaded. And here are your exception details. So young Emily here has got a medical contraindication. Now, on this screen here, which I've just added the filters to. I could, for example, decide this week I'm going to contact or try and recall patients that have had no COVID vaccines or perhaps only one. Or I can change the data in this report to actually show oldest to newest. So I can target from the top all of our older patients. So just manipulate that to whatever it is you need to. And this is where the batch numbers can play an important part. Say perhaps, for example, there has been a problem with the batch and we need to recall all the patients that may have been immunised with that batch number. So you can even select by a batch number on here just to find out who was actually given that batch. So batch numbers do play a very important part in the air. And then last of all, you can just obviously again manipulate this one into oldest to newest. And so we're starting here on this record, whilst this is individual 19 in the 42A report, they are in actual fact the person that whose COVID vaccine was the oldest. So they're well behind, so to speak. You might target them that way. So yeah, so what you can do is you get your data and then you can change it, add some colors. I mean, I like to add colors. It helps me break up the data that I'm looking at and, just do whatever you need to do. If you delete or, we can all do it. We can all make a mess of something. Just download it again. There's no harm. Easily done. When you go into a website, just download the report again. It's a simple matter to download. If we go here to view and we go to options and download, and just save as and download. So very simple to do that. All right, so that is our reports. I will just now go back to our presentation. And I just want to talk about our education resources. So on the Services Australia website, we have AIR e-learning modules. So you've got the register as a vaccination provider, accessing the AIR, logging onto AIR using HPOS, overseas immunisations, submitting information to the AIR, and the immunisation medical exemptions. We will be in the near future adding some more e-learning modules. So it's good to check this, although I will let Adele and Jody know, because there will be an e-learning module for the 10A report and the 42A report as well. So that might be useful, although I hope perhaps you might be happy enough from tonight to go back to your practice when you're next there and start ordering so that you can have a look and have a play, so to speak, although obviously it's real details, but just to see what they all look like for you. We also have AIR infographics or sheets that you can have a look at. Again, very similar to what we just discussed about submitting information. If you don't want to look at an e-learning module, you've just got a cheat sheet which has got all the information, updating vaccination data. And for those of you that might be, if there are any practice managers out there tonight, adding members to an organisation, delegate access to the AIR, all that sort of information. Okay, so for any more information, you can email our AIR team at air.servicesaustralia.gov.au, noting that that's not secure. So please don't put any patient details in that email. If you do need to perhaps have a patient's record corrected in some way because you weren't able to update it, then you would use your HPOS messages, which is in our first webinar in the July presentation that we've done. We've also got the help desk numbers there and the web, and as I mentioned, the HPOS messages. So that concludes our presentation today. I hope that you found it useful, and I do thank you for your attendance.